current landscape of colorectal cancer, there are a lot of different options, but the majority are still chemotherapy backbone based. And I think that's important to keep in mind for patients. A lot of patients have a lot of interest in immunotherapy as a treatment option, but the reality is that patients that are eligible to receive immunotherapy in metastatic colorectal cancer is going to be less than 5% for the stage 4 patient population. So I would say that there's still the standard chemotherapy regimens such as FOLFOX and FOLFIRI. I would highly recommend FOLFOXIRI if your patient is well enough to receive treatment, has great performance status, and their laboratory tests are within normal limits. I think it's a good idea to be aggressive. I think it's also more important for the patient to understand it is very important for a treatment-naive patient to know which side their original tumor is on, because that will help determine whether or not they would or would not benefit from anti-EGFR therapy. I think it's an exciting time, in all fairness. And then I think it's also very important for many oncologists to recognize the importance of molecular testing early on in the treatment instead of just waiting for third or fourth line chemotherapy, because you really have to think ahead. What's going to be your next step if the patient is intolerant of treatment or has an allergic sensitivity reaction? You just want to be having a strategic plan for your patient.